this is a very relevant question because all these markers, all these new tools that can be implemented in our everyday life when managing patients with MS, from diagnosis to prognosis, need to be really moved into the all clinical settings so that all patients can take advantage of that. And for this, I think it's very relevant, at least at present time, the paper that we recently published, the MAGNIMS, CMSC and NAIMS collaboration, a consensus guideline on the implementation of MRI in clinical practice for the management of patients with MS. There were two talks on that, on one of the scientific sessions, one by Professor Alex Rovira, the other by Professor David Lee. Professor Rovira went through all the recommended and optional sequences that need to be run in clinical practice. And Professor David Lee stressed the point of the dissemination of this. So getting back to your question, I think it's very important to, as Professor Rovira said, and also Professor Lee, that these guidelines are put into practice. They achieve a wide dissemination across all centers. So it's not just discover new markers, it's not just publishing guidelines, it's trying that these guidelines are go into the real world.